Hello, my name is Eleanor Mitchell, and I'm an undergraduate research assistant at the University of Tennessee Medical. Today, I'll be presenting my project titled Perinatal Depression Screening and Breastfeeding Outcomes by Interpretation Modality Among Spanish-Speaking Obstetric Patients. This work was conducted in collaboration with the Women and Infant Center at the University of Tennessee Medical. Spanish-speaking perinatal patients with limited English proficiency often face communication barriers in healthcare settings, which can contribute to disparities in maternal outcomes. Professional medical interpreter services play an important role in improving communication and patient care. The purpose of this initiative was to evaluate whether interpretation modality was associated with differences in postpartum outcomes. In-person Spanish interpreter services were implemented in the obstetric units at the University of Tennessee Medical Center in November of 2023. This study included patients who delivered at our institution in 2025 and reported Spanish as their primary language. Interpretation modality was identified through documentation in the electronic medical record. Patients were categorized based on interpretation modality as either in person interpretation or virtual-only interpretation. Outcomes evaluated included perinatal depression risk and breastfeeding outcomes. Perinatal depression risk was defined as an Edinburgh postnatal depression scale score of 10 or greater. A total of 435 Spanish-speaking patients delivered in 2025. Among these patients, 374 individuals, or approximately 86%, received in-person interpretation, while 61 patients, or 14%, received virtual-only interpretation. These findings demonstrate that in-person interpreter services were widely utilized in this patient population. When evaluating perinatal depression risk, 4.9% of patients in the virtual-only interpretation group screened at risk, compared with 6.4% of patients in the in-person interpretation group. This value was not statistically significant with a p-value of 0.65. Breastfeeding outcomes were similar between groups. 70% of patients in the virtual-only interpretation group breastfed compared with 68.6% of patients in the in-person interpretation group. This difference was also not statistically significant with a p-value of 0.83. Overall, the majority of Spanish-speaking obstetric patients in this cohort received in-person interpretation services, while a smaller proportion relied on virtual only. In this cohort, interpretation modality was not associated with statistically significant differences in perinatal depression risk or breastfeeding outcomes. Postpartum outcomes were comparable between patients receiving in-person and virtual-only interpretation. Although outcome differences were not observed, interpreter services remain essential for supporting equitable and patient-centered care for individuals with limited English proficiency. Future analysis will include additional years of data, including periods prior to interpretation implementation. Continued evaluation will help to determine the impact of interpretation services on maternal mental health, breastfeeding outcomes, and perinatal health equity. Thank you so much.